everyone, so let's move towards our today's topic, which is
now moving towards this topic, development of the heart. Development of the artery. The topic is development of the arteries. Like I said previously, secondary heart field will form aorta and pulmonary trunk. So what happens? The dorsal aorta will arise, and dorsal aorta will supply to the pharyngeal arch. Okay, and as you know, there are 6 pairs of pharyngeal arches in the neck region of the embryo, and each pharyngeal arch, okay, has its own blood supply. The 5th pharyngeal arch will degenerate, so there will be only 5 pairs of the pharyngeal arch. Okay, now these pharyngeal arch obviously by the time they will degenerate, the first aortic arch will appear on 27th day, and then second, then third, then fourth, then fifth, then second aortic arch will arise. Okay, and aortic arches will arise from dorsal aorta. First aortic arch will form maxillary artery in the future. Second aortic arch will form hyoid artery in the future. Third aortic arch will form carotid artery in the future. Fourth aortic arch will form arch of the aorta and the right subclavian artery in the future. The 6th aortic arch will form pulmonary arch in the future, and I've never told you about the 5th aortic arch. So 5th aortic arch will degenerate. Okay, they will form, but they will degenerate. They will not form in the future. Now, this you have to remember that which aortic arch will form what. Okay, now vitelline arteries carry, remember this point, all the arteries in our body carry oxygenated blood except pulmonary arteries and the umbilical arteries. We are talking about vitelline arteries. Okay, so arteries will carry oxygenated blood from yolk sac towards heart. Okay, from heart to yolk sac. Okay, now umbilical arteries carry deoxygenated blood from heart to placenta, and from placenta they will oxygenate and then return back to the heart by umbilical veins. We will discuss later in this recording, but you have to remember these points regarding development of arterial system of the heart. Now we are talking about development of venous system. You have to memorize this diagram. You have to take a picture in your mind of this diagram, which is in my notes, which is very, very, very important. Okay, you can easily see sinus venosus, anterior cardinal veins, posterior side, left side, right side, cardinal veins, vitelline veins and umbilical veins. So obviously anterior side की veins क्या कहलाएंगी? Anterior cardinal veins. Okay, right side की होगी तो anterior right cardinal vein, anterior left cardinal vein कहलाएगी left side वाली. विटेलाइन वेन ऑब्वियसली पोस्टीरियर साइड पे ही होती है, तो हम उसको ये नहीं कहेंगे पोस्टीरियर विटेलाइन वेन, हम ये कहेंगे लेफ्ट विटेलाइन वेन, राइट विटेलाइन वेन. ओके, अम्बलाइकल वेन को राइट अम्बलाइकल वेन, लेफ्ट अम्बलाइकल वेन. सो vitelline vein, like you know that all the veins in our body carry deoxygenated blood except umbilical vein and pulmonary vein. We are talking about vitelline vein. Vitelline vein carry deoxygenated blood from yolk sac to heart. Umbilical vein, obviously there is an exception in the veins, that is pulmonary vein, and umbilical vein will carry oxygenated blood, and we are talking about umbilical vein. So umbilical vein will carry oxygenated blood from placenta towards heart, so that it can supply to the whole part of the body of the fetus. Now cardinal veins carry deoxygenated blood from the entire fetus. Okay, now the cardinal veins, first we will talk about umbilical veins. Right umbilical vein will degenerate first, and the left umbilical vein will degenerate after birth, after 2 months of the birth. When the baby's age is 2 months, they will degenerate. What will be degenerate? Left umbilical vein. Okay, now left umbilical vein will supply to liver, then it supply to heart, through ductus venosus by draining into inferior vena cava. That means that left umbilical vein is forming inferior vena cava. Okay. Now vitelline vein, in vitelline vein there is an opposite side. The right will supply liver and left will degenerate. In umbilical vein, right umbilical vein will be degenerate. In vitelline vein, left will be degenerate. Okay. Now the most important topic and most interesting topic is cardinal vein, which is very simple. Mostly teachers will say that this is a very difficult topic, but this is very easiest topic. If you see my diagram in my notes, you can easily memorize it and you can easily understand it. Now cardinal veins, there are two anterior cardinal vein and two posterior cardinal veins, right side, left side. Okay, there will be four cardinal veins. Okay, right anterior cardinal vein, left anterior cardinal vein, right posterior cardinal vein, left posterior cardinal vein. Okay, now anteriorly, the left cardinal vein will form the right and the left cardinal vein. From the left cardinal vein there will be a branch which anastomose means meeting. They will meet with the right cardinal vein, and that branch is called as left brachiocephalic vein. Okay, now the remaining part of the left cardinal vein, which is attached with the left horn of the sinus venosus, obviously those cardinal veins, umbilical veins and vitelline veins are draining in the sinus venosus. So the remaining part of the left umbilical vein, left anterior cardinal vein, which is draining in the left horn, will be degenerate and regress. This will happen. This anastomose, left brachiocephalic vein, will form in 8th week. Okay. Now the right anterior cardinal vein will form superior vena cava, is known as superior vena cava. Okay. So superior vena cava is formed by right anterior cardinal vein. Now moving towards posterior side. Posteriorly, posterior cardinal veins will divide into three parts: subcardinal vein, supracardinal vein and common iliac vein. You know that common iliac vein will supply to the lower limb. The subcardinal and supracardinal veins will supply to gut, liver, abdomen, वगैरह वगैरह, etc. Now they will form these posterior cardinal veins will form hemiazygous system and azygous vein. Okay. Now the most important topic is inferior vena cava. There are four segments of inferior vena cava: hepatic segment, pre-renal segment, renal segment, post-renal segment. There are four segments. Hepatic segment, as we have already talked about, that left umbilical vein will drain into the liver, and from the liver they will bypass and they will enter into the heart by into the sinus venosus. They will form inferior vena cava. That segment is hepatic segment. The pre-renal segment, they will form from right subcardinal vein. The pre-renal segment will form from right subcardinal vein. The post-renal segment will form from right supracardinal vein. The renal segment will form anastomose. It will form from anastomose between subcardinal and supracardinal vein. Now, as you know that posterior cardinal veins are left side is on the left side as well as on the right side. Both left and right side will divide into three parts: cardinal vein, subcardinal vein, supracardinal vein and common iliac vein. So this is the whole topic you have to remember, and it's done. Okay, this topic is done. If you are listening this recording from the if you are listening this topic from this recording, okay, very good. But after listening this recording, just one time, read this topic from my notes to understand this topic clearly. ओके जब आप ये कर लेंगे, रिकॉर्डिंग भी सुन लेंगे, वीडियो भी देख लेंगे, जो वीडियो है ये और रिकॉर्डिंग ये आप सुनने के बाद जब आप नोट्स पढ़ लेंगे मेरे, या इसके साथ साथ ही नोट्स पढ़ लेंगे, तो आपको बहुत सारी चीज़ें क्लियर हो जाएंगी. सो गाइज, टेक केयर ऑफ योरसेल्फ एंड स्टडी हार्ड, वर्क हार्ड एंड गुड लक. बाय.